Today, a paramedic's worst nightmare.
There's a 7-year-old child that's been hit by a car.
Catherine helps a teenager in trouble.
Is your throat sore at all? Can I have a look in your throat? Open, say ah. Yeah, you got a red throat.
And a man with a chronic lung condition puts on a brave face.
My lungs are shut.
Right.
And if I get up too quick, my legs go.
Bless you.
And I've got a Chinese in there going cold.
Have you? 9-8.
9-8, go ahead.
9-8, safely at Children's. We're clear and available if required.
One of the things that I enjoy most is we're quite a small team of people and we have quite a good relationship.
Got another job, guys. Yeah, got another job.
So although we have to deal with some very serious and a lot of the time emotional cases, it's working with the team of people that I work with that actually helps just make it a doable job, really.
It's an RTC car versus 7-year-old. Care team are on the way, but they're going from the QE, so we're closer. Going through all the dodgy roads where people run out in front of you tonight.
So this job's come through as a car versus pedestrian, and it's come through initially as a 7-year-old child that's been hit by a car. So there's ourselves and another ambulance resource going to this incident at the moment, and we should get some more details en route. Looks like it's on a roundabout.
Say again?
It looks like it's on a roundabout, isn't it? Is it just off?
Is it? I think it's on Warwick. It looks like Warwick Road. 110. I know, there it is.
22. People there in the middle. Yeah, there we go.
Arriving at destination point on left.
Looks like he's very standing up.
Doesn't it?
At the scene, the boy appears to be standing and has no visible injuries, so Matt tries to find out what's happened.
Hello. Hi, I'm one of the doctors of the ambulance service. What's has happened?
Car accident.
Okay. And it hit him, did it?
Yeah.
And what happened to him? Okay. Did he fall onto the floor or did he get thrown? Onto the floor, okay. And did he pass out at all? No, he's been awake. He got up off the floor? Okay.
First he was lying down and he was like...
What's his name?
Fiyad.
What's his name? Fiyad. How are you feeling, Fiyad?
To find the child standing up when we arrive at an incident like that obviously is a big relief. Fundamentally, if the child is standing up, then there's far less chance that they're going to have had significant injuries.
Okay. Did you bang anything when you fell on the floor? Have you banged your head or your neck? Can you turn your head round to both sides? And round this side? Good stuff. Oh, can I have a little look at your chest? Is that all right? So you didn't bang your chest at all? That's all right, ma'am. Let's have a look. Cool. No pain in your tummy? No? Okay, let's have a look at your legs. Any pain in your legs here? No? Can you stand on one leg? Can you stand on the other one? Better than me, aren't you? Can you lift your hands up behind your head? And behind your back? Good stuff, okay.
You can have injuries that aren't immediately apparent. Again, that's part and parcel of why it's important for us to assess the patient thoroughly. In this instance, there didn't seem any significant injury. That's not to say that there might not be something.
Is one of you mum? Your mum, are you? Okay. It doesn't look like he's got anything serious going on, all right? But we need to have a look at him in the light when we get an ambulance here, okay? Do we know how fast the car was travelling? Is the driver here?
Got a crew en route at the moment.
So we probably spent a good half an hour on scene at this incident, liaising with the police, waiting for crews, etc. And throughout that time, we were communicating with the patient and making sure that there were no changes.
Do you want to come over here and we'll have a look at you in the back of our car? We'll just bring him into here. So we just need to have a look at him here. Come and have a seat up here. All right. There we go. So is anything hurting at all at the moment? No? No bruises or bangs? Okay, can I just have a look at your face? Open your mouth. Ah, good stuff. And here. Shoulders all right? Yeah? Arms all right?
Just because we're still on the active road, if you can go back on the path, just because it's not particularly safe.
Which bit hit the floor? Which side did you land on the floor?
Yeah.
Which side? That side or that side? That side, is it? Okay, and no pain there at all, no? Okay, all right. I can't find any injuries, Rich, with him. Discharge on the scene, as long as it'd be nice just is the driver here?
I can go and find...
It'd be nice to have a look at the car and things, but...
Speed and stuff and...
Yeah. We're just going to have a look at the car and have a chat with the driver, just to establish exactly what speed people were doing when he got hit.
Is that driver? Yeah. Can we just get rough speed and things?
Possibly the wing mirror that he's called.
It's just... Is it... He just hit this? Yeah, OK. I'll go and have a look at the car, but that sounds about right. I'm just going to check the car, but it sounds like from the driver that it's just the wing mirror that's clipped him, and it hasn't broken or disrupted the wing mirror, but I'll go and check. It happened that side of the road, didn't it?
Yeah. But this side.
So over that side?
Yeah.
And
His car is heading on this floor, this side.
Yeah. But it was on that side. He hit that side of the car as well.
Yeah. Only that side go. And one car, no stop, a green light.
Yeah. Okay.
And
There's a distinct difference between someone being hit by the front of a car travelling at 40 miles an hour, for example, to that of somebody that's been clipped by a wing mirror. So although he looked perfectly well, if we'd found that he'd been thrown onto the bonnet and he'd hit the windscreen, we'd have had a higher suspicion for some underlying injuries.
need a hospital?
Probably not, no. He's not got any sign of any injury. Yeah, he's okay, all right? What we do is we'll just put our little monitor on you, measure your blood pressure and your heart rate, just so we've got a record of it, okay? So we'll put some leads on, okay? So, yeah, just grab the life pack and we'll do that. And then hopefully let you go home, all right?
Police were still on scene at that time, I believe still sorting out exactly what had happened with the driver. So we left that patient in the care of his parents.
If he starts developing any aches and pains, all right, that aren't relieved by simple painkillers, then he needs to go to the A&E, all right? And that's what this effectively says on here, and you can keep, we'll give you a copy of this, okay?
Did you finish today or yesterday? Today? Did you have a fun last day? Yeah. Did you play games and things? Better than normal days at school?
Generally, cars, when they hit children, the car generally wins. And he was very lucky in this case that he just got clipped by the wing mirror and not hit by the actual car itself. Yeah, 9-8. So we've examined this little chap. He's uninjured, so we're discharging from the scene. You okay? All right. Just be careful next time, okay? I think anyone would be lying to say that they weren't slightly anxious when attending to a sick child or potentially sick child. You know you're going to enter potentially a very challenging emotional scene. So to arrive and see a child that's awake and talking and confirming that they've got no injury is a relief and makes our life much easier.
And quite regularly with asthmatics, especially with more brittle or more severe asthmatics, they know a lot more about their condition than we do, and it is literally they have called you because they know that they need to be in hospital. we're just off to a female who's reportedly having an asthma attack. And once we're there, it'll be a quick assessment, decide what medication she's going to need, whether she's going to perhaps need nebulizers, and then, depending on how she relates to the treatment, as to whether we can sort of safely leave her either at home to follow up with her GP, or whether she's going to need hospital admission. It's this time of year now, we're coming into autumn, we see a rise in all of our breathing problems and, you know, issues related to sort of the cold, damp air that we get at this time of year.
With asthma claiming an average of 3 lives every day in the UK, Mike needs to act fast to stabilise the woman's breathing.
What's going on?
I took some tablets the doctor gave me yesterday, but it getting it.
OK. What's your name?
Pamela.
Right, Pamela. Just try and slow your breathing down a little bit for me, all right? I think the first thing when you see anyone struggling to breathe is to try and reassure them. Because as soon as you feel like you can't breathe, panic sets in.
I took me inhaler and had my nebulizer.
OK.
And
It still feels quite tight, does it? OK, let's have a quick listen myself then, all right? Nice and calm, steady approach, and then go on as to why they got this problem. Don't talk for me a second, just breathe in and out, all right?
That day started when I went to the doctor's to get some tablets to help me with some giddy turns. And she did warn me that, be careful, Pamela, she said. These may upset your asthma.
OK. You do sound quite wheezy, don't you? What we'll do, all right? Have you done a peak flow reading before?
I've done one before.
OK.
My husband went down the surgery and my son turned up and I was gasping for breath and he says, Mum, are you all right? I said, no, not really. I was gasping and all these bubbles were coming up in my throat and out my mouth.
You can do a quick one of them whilst I'm setting the stuff up, all right?
I were in a dreadful state. I didn't even think I would make it.
Before Mike can help Pamela's breathing, he has to carry out a test to see how well her lungs are taking in oxygen.
If I get you, just hold it like that, and then a nice big deep blow. Okay, 250. Best of 3 if you can be.
OK.
A normal reading for a woman of Pamela's age should be around 330, so she needs medication to help open up her airways.
Go on, I won't make you do that again because you're struggling there, aren't you? I just try and relax me, all right? I know it's easy for me to say.
No, it's not. It's all right.
But
I know what you mean.
You need to try and just relax a little bit. Gave Pam a nebulizer. The drug we used in that was called salbutamol. That's basically the same as Ventolin that you see patients using their blue inhalers. Steady as you go. There we go. Right, some nice, calm, deep breaths of that. Just relax. Go on, you don't have to hold that up. Just relax, OK? Right, quick little pinprick on your finger, just to check your blood sugar, all right?
No problem.
You're a nice, easy patient. It appears the lady has got a wheeze, which is quite common with asthma. So what we're doing, the medication that she's just having now through the nebulizer should open her airways up. Have you been coughing stuff up more frequently?
Not just occasionally.
OK, and is it worse than today? OK. I think it's probably going to be a trip up to see the doctors, all right? So we'll call up for a crew to come and collect you now. Can I have an amber backup, please, Bip?
Roger, amber backup. Get on to you, thank you.
Right then, Pamela, let's get you another one of those going, because it doesn't seem to be giving you much help, does it? So this, have you ever had hypertropium before? You just got to breathe it normally, all right? I'm just going to disconnect you from this a second. How long have you been this short of breath?
This morning.
Too long.
An hour? 2 hours?
About an hour.
We've just tried another medication. It's called ipratropium bromide. So the lady had before was salbutamol. Just obviously she's still got the wheeze. You can hear that, without me needing to put my stethoscope on. So it's important that we can try and alleviate that. So she's getting well oxygenated. Hello. Right, guys. This young lady is Pamela, known asthmatic. Has acute episodes, has ended up in resus, but hasn't ended up with intensive care type admission. This morning, I started feeling more wheezy, having taken some of these because she's been suffering with blackouts, so the GP's provided her with those.
But you know your nebuliser? Yes. What do you put inside your nebuliser? This one?
Yes, I know.
Yes. Why don't you just sit forward for me? Just try and relax, all right? You're okay? All right? Yeah. Very, very tense, so just try and relax and calm that breathing down, all right? There we go. This medicine's going to really help your chest now.
Eventually, the treatment started working on Pam. Her breathing eased. However, she obviously had an underlying cause for her asthma flaring up in the way that it had. So the best option for her, given her history as well, was that she was transported on to hospital. Yeah, everything else, tickety-boo.
Couldn't wait for them to come through the door to help me. They'd never let me down. The courtesy of them. The dignity of them. You could not falter. They never left you till they was happy with you.
Right. Pam, I'll leave you with Danny now, all right? Emma.
Thank you.
That's all right, you take care, my love, all right?
Thank you for your kindness.
Oh, that's all right, no problem. I hope you're feeling a bit better soon.
Definitely.
Take care, all right? Well, the lady suffers with a chronic condition. Well, you could hear her wheeze, obviously, without needing a stethoscope. That's a sign that, obviously, her airways are struggling. It's not something that we can quick fix and then refer to a GP or, for ongoing care. She needs longer, more intensive, ongoing treatment, and the best place for that's going to be A&E in this case. My hope always is that she'll make a full recovery and be back as she was before. Hopefully, all being well, she'll be back home before long.
I'd say 75 to 80% of our workload is the elderly. The most common issues we have with the elderly, it tends to be chest pains, breathing difficulties in falls, falls probably being the most predominant. So we just have to go and pick them up due to the fact that they've got the inability to get themselves up off the floor. We are going to a 73-year-old gentleman that's in a constitutional club. It's actually like a members club. Sounds like he's had a fall and he's bleeding from an arm injury. Hopefully, by the sound, it's not too bad, so we should be able to treat him at the scene. We might just encounter a bit of traffic. Staffordshire, where we are now, it is made up of quite a large population of elderly, which most of our workload in the area is tends to be mainly falls and wounds from the falls and injuries caused by that.
Cancelling all functions.
At the Constitutional Club, a member of staff is concerned that the man will refuse treatment.
He's just said he wants to go home. I'm letting you know.
Yeah, no, it's my sort of thing, chick.
Okay.
Right, yeah, no worries. OK, chick. Cheers, darling. I didn't make you all right.
Paramedics.
It's all right. Hello.
He's going to his car.
Oh, we'll sort him, chick, don't worry. If he's all right, he's all right. Oh, sorry, sweet. I'm going to stand in front of his car.
I'm 200%.
That's all right. You stay where you are, my man. We'll have a look at you. Which is your motor?
This one.
That one. Pop the boot then and have a sit on there, and then we're sorted. If you're more right, you can go on. How's that for a deal? What's happened?
Years ago, I had sarcoidosis.
Right.
And it's come back.
Okay.
And my lungs are shot.
Right.
I've never smoked in my life.
Bless you.
And my breath goes. And if I get up too quick, my legs go.
Bless you.
I don't lose anything up there.
So you don't lose consciousness, it's your legs that go. Right. George was suffering with a condition called sarcoidosis, which is where the body produces small inflamed red patches within the organ. With George, it was definitely his lung, and we believed it was in his heart as well.
The sarcoidosis in George's lungs has severely weakened them over time.
So how have you been today in yourself?
All right. I've been better today than normal.
Although George is managing the condition with medication, his lungs are now vulnerable to other life-threatening infections.
He was in the club, just socialising with friends, and in his own words, he stood up too quick and went dizzy. And how are you feeling now?
100%.
He's 200%, I mean, there you go.
Except for my lungs.
So you remember everything that's happened?
Yes.
You have? Okay, mate.
I'll stay with you, mate. Thank you.
Bless you. If you pop a finger in there for me. Is it George, is it?
Yeah.
Yeah. Come here, George. George, is there anything else that you suffer with, fella?
No.
Super. What we'll do, we'll just make sure all your tests are fine. Have you cut yourself in any way, shape and form from falling?
Yeah.
On your elbow?
Only that's nothing.
OK, well, we'll have a look at that as well.
No, it's nothing.
Let's just put these ECG dots on you just to make sure your ticker's bouncing all right.
That's 100% as well.
You're very convincing. It's quite common that we bump into patients that they just get on with life. Some see it as it's the cards they were dealt, so they just get on with life and try and enjoy it as much as they can. They know what the condition is, they know how it affects them and how they just get on with things.
The heart's still going, isn't it?
It is, you're right. You proved me wrong.
I've been telling them all wrong.
It's what, mate? It's nice that people worry about you, George. Yeah. I think, really. It's when it actually comes to it, they've only got your best interests at heart, haven't they?
Yeah, that's true.
I think. It keeps me in the job as well. George, what I want you to do is just try and stand up now. Mind your head on this boot, for heaven's sake. I don't want you to go away worse than you actually had in the first place. We'll just do your blood pressure once more. Yeah. All right, just to make sure that is all right when we're up and about. There we go. Well done. Have a sit back down now, George, if you want, fella. George, he's got a long-term condition that's linked to his lungs. He's fully aware of, basically, if he gets up too quick, his legs give way and he falls over. Obviously, the staff here at the Constitutional Club are just a bit concerned, especially when he wants to go home and get in the car. We have checked out everything. There's nothing medically that's causing him to pass out. So the fact that George knows his own symptoms so well and he says he's back to normal, and we've proven that the tests are fine. We're happy for him to go home. He has just got a little graze on his elbow, so that's what we'll do. We'll just clean that up for him, do the paperwork and let him get on his way home. I think his wife will be wondering where you are, aren't you, George?
No, she's out eating somewhere. And I've got a Chinese in there going, go.
Have you? How have you been?
I went over for the Chinese before you come.
We do get a lot of people that aren't keen on going to hospital and generally as soon as we pull up don't want to go full stop. It's what they used to. They always suffer it from with their own condition, their long-term chronic conditions. George, if you keep their arm bent slightly, people are unaware of what really to do, so that's when they call the ambulance service. Just in a precaution, really. And as soon as we get there, the first thing they say is, I'm all right, and I don't need anything. Just for peace of mind, we check them out, make sure everything is all right, and if that's what they want to do, we can leave them to go home.
Just so I know.
Yeah,
it's all right.
Yeah, no, he's fine, mate. Bless you.
I've been
all
telling
right,
them all along.
Just to make sure.
No, you're all right, mate. No problem. Still, his obs are fine. Make sure he can get home safe. So, yeah, and eat his tea. I think he's more concerned about his Chinese getting cold. Bless him.
Unfortunately, shortly after John's visit, George's lungs deteriorated.
I do enjoy working with children. I do. A lot of people, it frightens, but I think the first thing you have to do is gain the trust. if you do manage to make them feel better, it is a wonderful feeling. It makes the job well worth doing. We're going to a young 14-year-old girl who's suddenly started vomiting and become breathless. If she started vomiting first, people can become very breathless through the physical effort of vomiting. If the breathlessness comes first before the vomiting, that's different. So, you know, it's hard to make assumptions, but at the moment, hopefully, it's something we can deal with on scene. Mum must be really concerned because obviously she's rung 999, like with the younger ones. If it's something serious, I think it affects most of us. You could still get as upset with elderly, but I just think, just such young lives, you know, you think of it differently. Houses without drives, you can never park. However, I think we're in luck. Somebody waving to us. Hello, my lovely. Hello. What's going on then?
Finding it hard to breathe. She keeps gagging now.
Okay. What's happened then?
I've just picked her up, brought her home. She's been sick.
Yeah.
High temperature.
Right.
And can't find it hard to breathe.
So this has all happened suddenly?
The last 20 minutes.
Okay. Let's have a look at you. My name's Catherine. What's your name?
Jessica.
Jessica, that's lovely. Pop your finger in there. Nice painted nails, aren't they? When I hear it's somebody young, if she's got no previous and she's breathless, one of the main reasons is that they could have got themselves very anxious. So that's good, so everything's working okay, all right? Can we take some nice deep breaths in? It does happen to a lot of people who don't suffer with anxiety, and it can just happen to us for no reason at all. You take a deep breath in and count to 2 and blow out slowly. Go on. You keep trying. Come on, sweetheart. Come on, don't get yourself upset. Don't get yourself upset. You just try and control that breathing instead of it controlling you. Okay? Nice and steady. Jess, look at me. Look, go. That's better. But while you're doing that, I'm going to have a little listen to your chest, okay? Yeah? That heart's racing a bit. We'll slow that down, nice and steady. I did her oxygen levels just to make sure that she wasn't lacking any oxygen, and they were 100%. I listened to her chest, and that was clear. That's fine.
But when Cav checks Jessica's temperature, a medical cause for her upset becomes apparent.
Sweetheart, I'm just going to pop this in your ear. Oh, yeah, she got raging temperature, 39.3. Have you given her any paracetamol at all? Okay. Okay. Have you got any paracetamol in the house that you normally give her? Can we give her some? Yeah? Is your throat sore at all? Yeah. Can I have a look in your throat? Open, say ah. Yeah, you got a red throat. Oh dear. A little feel here. I think the problem was, yes, she got a high temperature and she wasn't feeling too well. She'd probably got a viral infection, and being 14, because of this, she started to get herself very anxious, which led to a hyperventilating, which frightened all the family because it's not a nice thing to see. All right, I'm just going to do another couple of little tests, okay? Is that all right with you, Mum?
Yeah, that's fine.
So this is why you really have to get in there and get it sorted and take control. I'm just going to do your blood pressure. Have you ever had that took before? So you know it just goes a little bit tight on your arm, yeah? Okay. There we go. There we go. She's looking a bit more settled now, Mum.
Yeah.
Yeah.
Put on your head a bit though.
That's it. Heart rate's a lot slower than what it was. It was about 130 when we came in. It's still pretty fast, but we're getting there. We're calming down. I'll come and sit by you. Okay?
Thank you.
You're feeling better? Right, Mum. She's got reddening to her throat, but there's no white pus on her throat at all.
Yeah.
So I don't think we're at the antibiotic level at the moment.
Not just a viral.
Yes. Keep an eye on her throat. If it is that there's any white pus start on it, that's the time to go and see your doctor.
Yeah,
I think because she's feeling unwell, she's got herself upset,
Yeah.
you know, and hyperventilating, it causes you to have pins and needles and feel sick, but we're settling down now, colour's going back down again. You still look beautiful, you're all right, okay? Yeah? Mum, are you happy with her not going anywhere?
Yeah.
Yeah.
That's why I asked for the first response. I didn't ask for ambulance anyway.
No problem at all. You know, she's
Yeah.
good. But say keep up with the paracetamol. But that important thing, water. You must keep drinking. Yeah? She's been out playing with her friends over the park and probably put a little bit of a brave face on. Got herself home and started to feel really unwell and getting really upset with it. Just coached her breathing, calmed her down. And we've suddenly got a happy little girl where she was really upset before. But hopefully, just with the paracetamol and plenty of fluid, she should be feeling a lot better.
The hardest thing about being a paramedic is the suffering that you deal with. From experience, you know when people aren't coping, and sometimes it takes a stranger to come in the house and say, you're tired, you can't keep dealing with this, let's put something in place to help you.
The son of an elderly lady with Parkinson's has called 999.
We try and keep everyone at home, really, unless it's something significant.
The woman is in pain from an infected pressure sore caused by her immobility.
We'll only really send people to hospital if it's really, really necessary.
At the house, the husband of the sick woman, Melva, is waiting for John.
Hello, sir. Hello. The ambulance. Hello. You waiting for us? Yeah. Yeah. Oh, bless you. Where are we heading?
So when we arrived at Melva's address, the house was full. It was full of family, neighbours, everyone basically trying to sort the house out, moving beds. So yeah, it was quite evident that she got so much support. They were a lovely family.
Hello. How are you? Not too good. Okay. What's been happening?
She's gone off her legs.
Right.
She suffers with Parkinson's.
Okay.
Parkinson's, it's a debilitating degenerative brain condition. The typical symptom is the shaking, but it's more the mobility aspect of it that we end up being called for.
Other than the Parkinson's, does she suffer with anything else? Or how are you in yourself?
Nothing.
You feel bad in yourself, feel poorly, or?
Just don't feel right.
You don't feel right. That's a good enough answer. Can I get down to you? Have you got any pains anywhere at all?
You know, like.
Your lower back. I've read somewhere about pressure sores, is that right?
Pressure sores, right.
And has that developed quite quickly, or?
Yes, over the last 3 or 4 weeks. So.
3 or 4 weeks, okay.
Quite a big one as well.
Is that causing you more pain today than anything else, or than it has done?
They've been having the nurse out, haven't you?
Yeah,
they've been sorting or trying to sort.
They've been changing the dressing.
Okay. Can I do your blood sugar and your temperature? Is that all right? It just means taking a swat of blood out of your finger.
No.
She does feel quite warm, to be fair.
Yes, it does.
There we go. I'll pop this in your ear, sweet. Is that all right? Oh, you jumped there, didn't I? There we go. 38.2. Can we just have a look at your back? Is that okay? If we just sit you forward slightly, see how far we can get without upheaving you. Is that all right, my sweetheart? Come on, darling. Just come forward a little bit. Let's move your pack in. Bless you. Would it normally have that yellow tinge to the pack, to the padding on it, or what you've seen it at? I know they put that stuff on there.
Pressure sores are sore by their nature, and some people are absolutely agony for them. Melva probably got this sore due to the fact that there's reduced mobility due to her Parkinson's, obviously not being able to get about as much, not being able to get upstairs and things like that. She's predominantly sat down all day, and again, if she's not able to get about, these sores then can generate and cause issues.
Has she lost complete use of her legs? Or is she able to do any weight bearing at all? Or?
Gradually, it's like she tries, but it's like as if she's trying. You know, she wants to, but it's just not happening.
The coordination between the brain
and her feet is just not happening.
All of her tests are fine. Her temperature's up very slightly. It's 38.2, so it's classed as a high temperature, but not significantly high. The only thing I'm thinking is if we get her into hospital tonight and get her a full assessment, make sure that wound isn't causing any long-term infection within the body. Yeah. Okay. We'll arrange for an ambulance to come and we'll get it sorted. All right.
She's been gradually going off her legs over the past few weeks. Been more difficult to move. And today she just been hardly able to move at all. So I decided to call for professional help.
I suppose it was an emergency call to come and shift the beds down from upstairs to downstairs so Mum could get into bed tonight. But I'm not 100% sure what the paramedics said, but it sounds like she's going to go in for tonight at least.
For Mum to come back out, we can make sure there's a package of care put in place so Mum's safe here and you are safe here as well. I know the bed's coming down and that is a good start, but it's just the general things of going to the toilet and things like that. Is that all right with you? My only concern is that she can't mobilise. And the way we tend to look at it, especially at the time of the night it is, we've got no social care packages in place or anything like that. She's not really safe. And without sounding horrible, you're your age, you're going to do yourself some harm, really.
You've got to be careful that the husbands and the wives that are caring for their family members that don't become ill themselves due to the fact that they're caring for them. And when that happens, we need to kind of take a step back and put something in place to help them.
Why wear yourself out doing something that you haven't got to do with yourself? You haven't got to go very far now.
It is a difficult decision for the family, yeah, because it's kind of acknowledging that they can't cope.
I'm just going to give her some paracetamol. Come here, darling. Are you able to pop that on your tongue and swallow the tablet, sweet? There you go. Are we there? Squirting all over your phone.
Yeah, no wet t-shirts.
With your mum.
Oh, yeah.
5152. Yeah, thanks, mate. Could we just have an amber backup, please?
52. I'll get someone to as quick as I can of her.
That's lovely, thank you.
Family and friend support is the biggest thing that it helps us and it helps the patient. At the end of the day, it's that familiarity of someone that knows them, they know the conditions.
What's happening? Because obviously I've been.
Oh, right,
I've been making beds.
Basically, she's got a slightly raised temperature, and apart from that, everything else is fine. It's just whether or not the pressure sore just got some form of infection in there that's causing her to be off her legs, or if it's just a general deterioration. I think the concern is because she's here, her and her husband and John, they're just here, and he's having to cope. It's not really safe for her to be here, because if silly things like if she needs a toilet, as good as family are, they're not here 24 hours a day, are they? So what we'll do is we'll get her assessed at the hospital, get some bloods done, make sure everything is all right. If it's an infection, we can treat it. If it's not, then hopefully we can get her back home with a package of care in place. It's just there, and it helps John, helps Malva as well, and it helps the family as well. It's keeping a bit of normality, really. I think when we mentioned John, he kind of sighed a bit of relief, I think, deep down, whether he's been fighting this, I don't know.
There's a few little bumps on the way out. If we go to the right and look out. Well, hope they can just stabilise her, you know. I mean, Parkinson's is a progressive disease anyway, so there's nothing they can do about that. Just have to run its course. It's all the other bits and pieces that need sorting. So, hope for the best.
There you go, look at that.
Just get it to shuffle along this way.
Or centre around there, but...
Alright.
The news that Melva's now got into a care home is kind of proof that her husband was struggling and the family were struggling. To see them doing what they were doing, trying to get that house ready, is lovely to see, really. And they were doing everything they can to make sure that Melva was safe and able to stop at home.
It's like Christmas in this house.
We never had so many people in yet.
It also shows that the package of care put in place still wasn't good enough for Melva's needs, and a care home is suitable, and that would be the best course of action for her.
Just collapsed under her knees.